Hemophilia is an inherited bleeding disorder in which a person lacks or has a low level of a certain protein called clotting factors. So when we say clotting factors, it refers to the protein in the blood that control bleeding, and the blood doesn't clot properly as a result. So these lead to excessive bleeding. There are 13 types of clotting factors, and these work with platelets to help the blood clot. So platelets are small blood cells that form in your bone marrow. What causes hemophilia? It is a process in your body that known as the coagulation cascade. Normally, it stops bleeding. Blood platelets coagulate or gather together at the one side to form a clot. So then, the body clotting factors work together to create a more permanent clot in the wound. So it is a low level of these clotting factors or the absence of them causes bleeding to continue.
Depending your level of clotting factors. If your clotting factor level is mildly reduced, you may bleed only after surgery or trauma. If your deficiency is severe, you may experience spontaneous bleeding. So there are signs and symptoms of spontaneous bleeding, which include first, unexplained and excessive bleeding from cuts or injuries or after surgery or dental work. Second is many large or deep bruises. Third, unusual bleeding after vaccination. Fourth, pain, swelling, or tightness in your joints. Fifth, blood in your stool and urine. Sixth, nosebleeds without a known cause.
First, joint damage from repetitive bleeding. Second, deep internal bleeding. And third, neurological symptoms from bleeding within the brain. You're also at risk at developing infections such as hepatitis when you receive a blood donor.
Hemophilia is an inherited genetic condition, meaning it is passed down through families. It caused by defect in a gene that determines how body makes factors 8, 9, and 11. These genes are located on X chromosomes, making hemophilia an X-linked recessive disease. Each person inherited two sex chromosomes from their parents. Female have two sex chromosomes, male have X and Y chromosomes. Hemophilia C is an autosomal inherited form of disease, meaning that it affects male and female equally. This is because of genetic defect that cause this type of hemophilia is not related to sex chromosomes.
Doctors can treat hemophilia, such hemophilia A with a prescription hormone. This hormone called desmopressin, which they can give you an injection into your vein. This medication works by stimulating factors possible for the process of blood clotting. This medication can help to stop the bleeding from the patients with hemophilia. Your doctor can treat also hemophilia B by infusing your blood with donor clotting factors. Sometimes the factors may be given in a synthetic called recombinant clotting factors. Your doctor can treat also hemophilia C, which they use plasma infusion. The infusion works to stop perfuse bleeding. The deficient factor responsible for hemophilia C is only available in Europe. In general, the best way to treat hemophilia is to replace the missing blood clotting factor so that the blood can clot properly. This is typically done by injecting treatment products called clotting factor concentrates into a person's vein. Also, a hemophilia patient can go to a physical therapy for rehabilitations of their joint. Hemophilia is a condition that passes from mother to her child. When a woman is pregnant, there is no way that knowing whether the baby has the condition. However, if your eggs are fertilized in a clinic using in vitro fertilization, they can be tested for the condition. Then, only the eggs without hemophilia can be implanted. Preconception and prenatal counseling can also help you understand your risk of having a baby with hemophilia. Having hemophilia have risk factor, which is to have a family member who have also the disorder.
Other therapies may include desmopressin. In some form of mild hemophilia, this hormone can stimulate your body to release more clotting factor. It can be injected slowly into vein or provided as nasal spray. Second, clot-preserving medication. This medication helps prevent clot from breaking down. Third, fibrin sealant. This medication can be applied directly to wound site, promote clotting and healing. Fibrin sealant are especially useful in dental therapy.
As we age, our risk of joint damages increases. As a result, older adults may experience chronic pain and reduced mobility.
However, it is still essential to remain active to help strengthen joints and muscles, maintain a healthy weight, and provide an outlet for stress or tension.
Older adults are advised to choose activities that go easy. On the joints such as walking, swimming, yoga, pilates, cycling, strength exercises, dancing, or bowling.
Activities like jogging, basketball, or soccer and football are not recommended.
As a piece of advice, prevention is better than cure.